Well, good afternoon. I guess you can hear me from here. Good. So this is going to be a little bit of fun. These conversations will be very interesting. It's about behaviors in households, about animal source foods. Again, my name is Juan Andrade. I'm an associate professor of global nutrition here in the Food Science Human Nutrition Department. So this is a very focused session on the vital role of animal source foods and achieving global nutrition. Today, we delve into the world of typical household items such as eggs and milk, essential for the high-quality proteins and micronutrients, yet so often beyond the reach of most vulnerable due to the many social, economic, and cultural barriers. In the next 30 minutes, I hope, our three expert panelists will unpack the complexities of these barriers, from the deeply rooted gender biases that dictate who eats what and when, to the harsh realities of poverty and food insecurity that restrict access to nutritious foods. We will explore how cultural perceptions often hinder the inclusion of these valuable foods during complementary feeding and discuss dynamics within households where the nutritional needs of women and children are overshadowed. Our dialogue today seeks to highlight that while the end goal is universal, and I'm going to repeat that, the end goal is universal, adequate nutrition for all. The paths we take to get there are diverse. Because, and this is one of my pet peeves, we all need nutrients, but we choose foods, and that's where we disagree on how we take those nutrients into your diets. So let's begin a conversation that moves us towards actionable insights and inclusive solutions. So, I know these ladies enough that I can ask them to go dancing with me. So, this is gonna be a fun conversation. So I have here Kathleen Culverson, Ms. Wood, an animal scientist and gender scientist. She was an associate professor in animal sciences specializing in dairy and equine before becoming a gender scientist and has served as the senior gender scientist for the Livestock System Innovation Lab since its inception. She has lived and worked in multiple countries, including Honduras, which I am not from, but I went to school there. So we share a lot of good memories about maize and rice and beans. And Zamorano University, right? So she's been conducting gender analysis workshops, journal publications, and webinars. If you don't know Kathy, you should know her. Okay, so I also have Emily Auma here. She's an agricultural economist working for the International Livestock Research Institute as a senior scientist. Her work focuses on technological and institutional innovations in the livestock value chains and how it impacts on livelihoods. She's led the USAID Feed the Future funded Innovation Lab for Livestock Systems, phase one project in Rwanda that focused on behavior change interventions on nutrition education among poor households. She's currently leading a pig value chain project in Rwanda and as part of the phase two of LISL. She has a vast experience working with several countries in East and Central Africa. And she's from Kenya, but she's residing in Uganda, but is working on Rwanda projects. Again, this is a funny bunch. Fun bunch. Okay, so Heather Stark is an associate professor in the Department of Epidemiology at the University of Florida. Her background is in medicine and public health. Her research work includes improving maternal and child health, nutrition, gender empowerment, and health disparities in the African countries in Burkina Faso, South Sudan, Rwanda, and Ethiopia. And now we're actually working on the same project on eating 2 eggs a day in Rwanda. And this is the first time I physically met Heather. However, we have been in contact for about a year via Zoom. So I'm going to sit down and I'm going to ask some questions. First, I'm going to ask them to introduce these projects to you, and hopefully we have a dialogue conversation with the audience as much as we can. Okay.
Okay. So
go ahead.
Great. Thank you so much. So I'm going to be talking about a phase one project that we implemented in Rwanda. And the context was the high levels of child malnutrition in Rwanda. So we have 29% of children 6 to 23 months of age only meeting the minimum dietary diversity. So government has been so concerned about this, so they started implementing a livestock asset transfer program called Girinka, where households that are poor receive a livestock asset in the form of a cow. So the objective really is to improve incomes, improve nutrition, but also to enhance social cohesion among the households in Rwanda. So we identified 2 locations in Rwanda for our SBCC intervention that really focused on improving nutrition education, particularly among caregivers who are most of the times women. And in these 2 locations, the levels of malnutrition remain high, yet they're very high productive agricultural production areas. So we started with a formative study to understand what the key barriers are and what the opportunities are there. So we implemented a cluster randomized controlled trial with 3 study arms. There's one study arm that, of course, focused on the nutrition education among the Girinka beneficiaries. And then the second study arm was a comparable study arm that didn't receive the nutrition education, but the households were also Girinka beneficiaries. And then the last study arm, which was a pure control, were households that were eligible to receive a cow, but not yet. So the messages revolved around the importance of animal source foods, particularly if they were aware that children can actually consume cow milk from 12 to 23 months of age, and then how to handle milk safely at home, and at the same time how to recognize allergies associated with consuming milk. Thank you so much. I think I'll stop there.
Thank you. Okay, so Heather, tell us a little bit about the 1 egg a day.
Sure.
study.
Hi.
One-
I want to talk about the importance of what a difference an egg makes based on a research project that we implemented in Burkina Faso that aimed to improve the nutrition of children through increased egg consumption. In this project, we targeted a rural area in Burkina Faso that had very high rates of malnutrition. The households in this region primarily relied on agriculture and livestock for their livelihood and their diet, but they had very low dietary diversity and ate very little animal source food. And even though most households had chickens, barely any consumed eggs. So our research project was a randomized controlled trial, which we enrolled mothers and infants ages 6 to 9 months, and we encouraged the mothers to feed their child an egg a day. Our group differed in that we had a control, we had a full intervention group, which we gave the livestock assets of the chicken to and social behavioral change package. We had a social behavioral change package only, and then the control. And the trial lasted about 1 year and was very successful, increasing egg consumption rates from 0, basically none, to 7 per week, which is essentially 1 egg per day. It also reduced acute malnutrition. So I want to share some of the reasons that we feel that this project was successful. The first was engagement with the community. From the beginning, we engaged the community with our local partners from Burkina Faso. We went to the community. We not only engaged community members, but the local healthcare and the local livestock government officials. We had a very interesting, kind of an innovative way. Instead of just actually giving the asset, the chicken, to the household, the chickens were gifted directly to the child through our identified community champions. And that is the community champions were the village chiefs, the village elders, and the religious leaders. And this, by gifting the chicken directly to the child, we hope that the child will be the beneficiary of it. And by engaging the community, the elders, and the community champions, we hope that they would reinforce that the child will be the beneficiary of this. We not only engaged the community champions, but also we engaged the men, particularly the husbands and the fathers. And they were engaged and participated throughout this project. And I think mainly because women in this region have very little decision-making power surrounding household and dietary choices. The second reason we think it was so successful is we really empowered the community. And this isn't something that, the effect that we saw, we didn't even realize that we would have such an effect. But the women were enrolled and they attended did monthly nutrition and agricultural trainings. Whereas remember, they didn't feed eggs to their children. People didn't eat eggs here because they thought that eggs were either sold or that the eggs were used for propagation and continuing of the life cycle. But so the women were trained on the nutrition of eggs, how to cook eggs, how to prepare them, how to feed them to their child. But also the women were trained on how to raise chickens and increase poultry productivity. We additionally involved a lot of community members, helped organize these trainings. We had some behavioral change messaging. We had T-shirts made that show one child, one egg per day. We gave out flip books to the women, and the women created jingles. So there was really, this was a community project that the women in the community was proud of, and really in large part led to the success. And we hope it will be a sustainable success.
Excellent. And you can see that in all those photos, there's significant color here. And when I travel through Africa as well, I see that I try to bring these colorful ingredients into these diets. It's mostly white matoke or white cassava or rice or Irish potatoes and why not. And hopefully we can add more color to the diet, at least through eggs. So Kathy, you have been associated with these projects in some way, more than others. Could you tell us, because there are different pathways to providing adequate nutrition in a household. How has your project addressed this? How do you start thinking about designing a project in which you can connect with all these members that might be influential into this project's success?
Thanks, Juan. I want to say I had the pleasure of working with Emily on her project in Rwanda. And one of the interesting things, I'm going to kind of do a little zoom out for just a minute. I actually had written a paper a few years earlier on the Garinka Project, which is a government project that was actually involved after the genocide to provide one cow per poor family to elevate not only the amount of milk that was produced in the country, but also, in theory, to improve the nutrition, particularly of the families. And one of the things that we noticed that we started to do the research on this is that there had been nothing done to look at this from a gender perspective. And for those of us who are gender people, it was painful to see that. And so I really kind of dug into this in a little way because I was curious whether or not gender would have had any influence on this project. And indeed it did. As I think both Heather and Emily mentioned, that in many of the households that we work in, particularly in different parts of Africa and in many places in the world, the woman may be responsible for doing processing, production, and feeding the family, but she doesn't necessarily have the decision-making power over either the income that is generated or the use of that income in the household. And there has been data done to indicate that if the woman does have control over that income, then household nutrition improves dramatically. Not so always with the men. So one of the things that we really got interested in Emily's project was what if we did a little detour and we actually started to involve what I think Sarah Peterson called supportive actors. I love that term. To actually support the primary actors, which are usually considered to be the women in household nutrition. And so we decided to do a little pilot study with developing what we called model fathers, basically, and identified a bunch of men that were interested in actually learning more about nutrition and then taking that information out into their communities. And so we did some training using a third party, Three Stones International, in Rwanda to help make this a little bit more sustainable. And we had really great success. I was so excited about this because the men not only showed real interest at the end of this, but they also then demonstrated that we had an impact on particularly child nutrition as regards to animal source food consumption. It was wonderful to see that. I'm hoping we're going to get some more funds so that we can scale this up into other countries because there's a lot of research being done now on the external influencers in household nutrition besides simply targeting the women. And so I think this is really an exciting new adventure for those of us in gender and nutrition space.
That's great, actually. Again, and my students in the back probably are thinking that's why Dr. Andrade goes on a tangent all the time, because I learn from the expert here on trying to what is important to say at the moment. But I was going to go and tell you something else here, Emily, because you're starting a new project, and how of what you learned in the first one that is associated with this behavior change has molded or helped you think differently about the design ahead of time. And knowing that formative research costs dollars too, and we should put dollars into that because it actually can make a difference in what will be the outcome or success of the project. So can you tell us what are some learnings that you are actually implementing in the new project?
Right, thanks so much. And one big thing coming from a research institute is that we try to put most of the dollars in the data collection phase to try to understand the situation better. So we've actually already implementing some of the formative research and also included a little bit more in-depth baseline studies. So quite useful. But one thing I wanted to add is that for us to see the nutrition outcomes that we hoped to see is that you need an integrated approach, right? So it's not just the nutrition education, but you also need to think about the productivity of the livestock that you're talking about. In Heather's case, of course, it's poultry. In our case, it was cows. So it means we cannot go in narrow-minded and only think that a particular intervention will bring about the outcomes that we envisage. We need to give it a proper multiple-prong approach. Thank you.
Excellent, thank you. Yes, I think most of us, at least every time I travel, I ask kindly that they allow me to go into the kitchens to see how they are preparing foods. And some people are, most of the time they're standing up working, sometimes they're sitting because they are heating something on a burner on the floor, right? And then they are actually stirring it all the time. And you cannot move away from that because you want to get to a product that you're going to give to your porridge, you're going to give to your children. So any nuances on how to prepare food, one of my other pet peeves is that if we reduce the time of preparing foods, still nutritious, safe, desirable, but that you don't have to prepare or spend too much time preparing. How does that fit into this equation of, for example, milk or eggs? And anybody can answer that one.
I'm going to answer a different question.
Thank you.
Sorry.
No, you're good.
This actually stems from a conversation we had at our table when I think Sarah was talking, or maybe it was the previous speaker, that said, what do you see in this picture? And I was thinking about that, but then I was also thinking about what are some of the other external impacts that affect nutrition, and particularly from a gender perspective, and particularly for women. And I said, out-migration. If you think about the out-migration that's taking place in all the countries that we work in of the males, and if the women are left behind, what does that impact have on nutrition? And I've done a lot of work in Central and South America, and it's just devastating the countries. And I'm sure you guys have something to say about this. Sorry I didn't answer your question. But it just really struck me, if you think about who are the other players in the nutrition in the household, and we think about grandmothers, we think about mother-in-laws, we think about husbands and sons and whatnot, but what about some of the other external factors that we aren't controlling, like out-migration? Do you guys have
That's good.
I think it's very multifaceted, and there's lots of factors that are involved. To go back to, with the project that we did in Burkina Faso, we really tried to address and look at those. And I want to stress the importance of formative research, because we went in with our ideas and preconceptions, and then the formative research, we learned a lot that we could really tailor this project to be very successful. One of the factors that we realized is that if these women don't typically cook eggs, they don't know how. And we really stress, because we were able to meet with them multiple times, that not just telling them, not just showing them, but not just demonstrating, but having them actually cook it themselves with us, cook it for each other. And one of the most interesting things is they didn't really, there's questions about how to feed their child the smashed egg. And the reflex of the tongue, naturally, of the child wants to push the egg out. So we worked with a behavioral psychologist here at UF who actually just gave us the idea to use the utensil and flip it upside down so it puts it on the tongue. So we worked with things that may have been barriers, and we were able to overcome, and I think helped for the success.
Excellent. Emily.
I think I wanted to come to the question that you actually asked.
That's okay.
And I'm going to give it a different context, not Rwanda anymore, but coming back to Uganda where I'm working, and I'm working on the pig value chain in Uganda. So most of the men prefer to eat pork outside in restaurants. We call them pork joints in Uganda. So now the big intervention that we want is how to encourage the men to actually eat at home with the families, right? So when we asked them why they actually prefer to eat pork out, and they were saying, of course, apart from socialization, they don't like the way their wives prepare the pork, you know? And it's a reality. So it means we need to think through how we are gonna have these women prepare pork so that their husbands can also eat at home. So that's just an example of an answer to your question.
I think that's the, so when you look at nutrients, they will behave differently the way you cook them and get into a very delicious recipe dish. And one of the things that I think we have to contemplate always is that food enters through your eyes, through your nose, and then you eat it. Otherwise, won't be consumed. So a nutrient is a nutrient only if it gets to your tissues, it gets to your cells, and it starts doing your functions. Otherwise, it's not a nutrient. It's just a material there. So thank you for that comment. I had a comment too, and I mentioned it to Kathy, and this might sound awful to the Ecuadorians out there. But back then, I remember clearly that back when I was a kid, the conversation among my uncles was that when you marry and you decide to start your family, you bring the groom will bring his mother to the house to show the new bride how to prepare foods for the husband. So the husband actually enjoys this cooking. So it sounds awful, yes, and I'm gonna say it's not. But at some point, and this goes for everybody, we all need to learn how to prepare foods. Regardless if you are, get married or not, you're gonna have to survive in some way. And the comment you just make about pigs is excellent. You need to learn how to prepare. There's so many ways. You crack an egg in one way, actually different ways to crack an egg, different ways to prepare it too, which I think is interesting. So I, at this point, have a little bit of time for getting questions from the audience, and I know the audience is waiting to hear more from their experts here. So any questions, please come forward so you can ask. Thank you.
Ladies first. Okay, thank you. Okay. Thank you for giving us a talk about many projects. My question is for the work on chicken eggs in Burkina Faso. How you can evaluate the sustainability of this project? And I would like to know if how to be sure that after the project they continues to give eggs to the kids, and also how to know if the chicken survive. The two chicken, male and female, how to know if they survive. Thank you.
Thank you for your questions. So those were great questions. First, I want to let you know that we intended to go back to see the sustainability of it because of the conflict, extreme conflict in Burkina Faso. Almost all of the villages that we had implemented the project in are no longer in existence. People have migrated or fled because of danger. So we're in the process of trying to locate. We had our partners in Burkina Faso are trying to locate some of the families from the villages. That was 2 years ago, and we're trying to go back and interview them. We feel that it would have been very sustainable because the women going back and anecdotally were so excited about this project. They didn't know about we were measuring the children to monitor growth. They didn't really care about the measurements, but what they saw was that their child was so much healthier and so much more active than the other child. The husband saw it too, and they gave more chickens to the children. That the women said that they wanted to go, multiple groups of women, when we went and talked to them, said they wanted to go to all the other women in all the other village and tell them how important it is to feed your child an egg a day. So we feel that by the education also increased poultry production. We trained the women to be village vaccinators. We gave them training that typically was reserved for the men. And that was empowering to the women too, to increase production. Most of the families that were gifted the chickens said that they actually had more chickens. Like they asked, what can we do with? Because we have more eggs than our child can eat. Is it okay if we sell some or give them to the other children? So, but unfortunately we couldn't evaluate the sustainability of the project due to circumstances.
Hopefully more at next year's meeting, because we really hope to go back there soon. So the colleagues from Minera, so I'm not saying international staff can go there, but the colleagues from Minera are really working hard to locate the family. So to be continued. Thank you for your question.
Thank you, Saskia. My question goes to the one egg project again. Considering the animal source food consumption, do you really give due attention to the barriers of these animal source food consumptions before interventions, or you consider that all countries are all the same and they don't consume because they don't have it? Like, is it because they don't produce enough, or there are also barriers which might be different in different countries? I can also give one example here. During my PhD study, which is already 13 years ago, I was surprised by the number of households who produce chicken, who produce eggs, but quite majorities are not consuming that. And I have asked why. And the type of food items they consume is not so convenient to combine chicken and egg products, and they say, we don't like it. That was the answer. So it wasn't like because they don't have it, but there are also cultural taboos and all this stuff, and thank you.
Yeah. I'll say a quick word and then you can tell your example from Uganda. But I definitely think different communities and different regions will react differently. For our formative research, we were told by people in Ouagadougou, the capital, that no one will eat eggs because there's a taboo, a really strong taboo, that if you feed a chicken egg to a woman or a child, they'll become a thief. And people firmly believe this. We actually thought we would encounter that, and we didn't. But so I think different regions will have different reasons, and it's important to do the formative research as to why they aren't eating eggs. Is it knowledge? Is it access? Is it a taboo? And try to address those barriers. And again, engaging the entire community, that we hope to overcome any barriers. That helped us address barriers that existed.
Right. I'm just going to add on what you've said, and it's really, really true. Even for Uganda, the issue of egg consumption, particularly for pregnant women, it's almost a no-go. So one of the ways that we go around it is actually to work with the cultural leaders to sensitize them so that they can sensitize the communities, because they're the gatekeepers of those customs and rules. Yeah.
And sorry, I have to add something about that too, because there's a whole lot of circulating gender and food myths that exist, and they're absolutely astonishing. I actually started to collect this information on all my travels, and one of the best ones I heard was from Ethiopia, where pregnant women were not supposed to eat eggs because the baby will be born bald. And there are so many myths, particularly around women consuming animal source food products. And so I always have to think about this from an equity perspective. What does that really mean? So who gets to eat the meat? Who gets to drink the milk? Who gets to consume the eggs? So it's not the female.
I think, are we done? Okay, good. So if you have some questions, we'll be here for networking as much as we can. So I would just want to say thank you for our panelists for coming and sharing their wisdom. There's a lot more work to do, and hopefully we brought you the message that there's many pathways to nutrition, and one of which starts with paying attention to who is eating what and when and with whom. as we want to eat foods as in a family. So thank you very much. Thank you, panelists. Yeah.